Now, I'm sure by now you know that our case count is more than 3,000. Well, checks reveal that we, the young people, are testing positive. Now, in the Ashanti region, for instance, more than 50% of the cases are people below 50 years. Now, I've been asking myself this with my team and my producers. We ask, what really is going wrong, or what has gone wrong? So now we're going to speak to Dr. Paul Owusu-Ojo, who is a public health specialist, and he's joining me now. Hello, Dr. Owusu-Ojo. Good morning. Thank you for joining us on JoyNews Interactive. Hello, Dr. Paul. Good morning.
Good morning, and thanks for having me.
Thank you, too, for joining us this beautiful morning. How are you doing, sir?
I'm doing well. How about you?
I'm doing fantastic, sir. Doing the possible best and keeping myself safe. Now,
it hasn't been easy for everyone.
At all, sir. At all. Some of us are dealing with this thing more psychologically than even physically. You know, the fear of the unknown, and when you step out of home and stuff like that. But talking about fear and everything, is it a scary moment?
No, I don't think so. It is not a scary moment, because I have said on your platform before that fear and anxiety will rather weaken your immune system. And then if you get the infection, chances of you fighting it off may be difficult. So this is not the right time for us to harbor fear. The figures are going up all right, but I think it is good, because if you have to look at it in the late term, all these persons that have been fished out from the society, if they are left there, they will be spreading the infection and everybody will be at risk. But once they've been taken out of the society, it makes it safer as compared to if they were left there. So the more we are able to pick them out of society, who would have ordinarily come into contact with these persons and then catch the infection.
Now, sir, I want to ask you, why is it that we, the young people, are the ones, you know, being infected more? Because about 50% in the Ashanti region are said to have been infected, and they're all below 50. Why is it that we are the ones that are being infected more?
Okay, it's for two reasons. The first is the economic pressure, and the second one has to be with behavioral. Economic, because if you look at the working class or the working age group, I think it is estimated that between ages 15 and then 64 or so, depending on the country, majority of the persons who have tested positive happens to form a greater portion of this working class. We all know that the battle line is at your doorpost. So as soon as you step out of your home, you are at a greater risk of contracting the infection. So what we are saying is, if majority of the working class happens to be within this age group, they have to go out and make ends meet so that they can take care of themselves, their family, and other dependents. So as soon as they step home, they put themselves at risk. And it is therefore not surprising that we are getting a lot of persons with the infection who falls within this young age group. Secondly, behavioral. Young people are less likely to stay at home, even if they don't have anything doing in town. We are more likely to hang out with friends. Young people are more likely to stay out after work as compared to the elderly or the old people. And we know all these things predisposes you or increases your risk of you contracting the infection. And then secondly, when it comes to the precautionary measures, elder people are more likely, the elderly are more likely to adhere to them as compared to the young. The young ones are known to engage in risk behaviors, which will predispose them to catching the infection. And it's not only in Ghana, most countries across the globe are recording this trend. And I believe it's because of these factors. One, the economic pressure. These people have to go out and make ends meet. And as soon as you step out, you put yourself at risk, and chance of you contracting is higher. And the fact that behaviorally, young people are less likely to stick to precautionary measures and stay at home as compared the elderly people. So
Yes.
in my opinion, that is the reason why we are getting more infections within the young age group as compared to the elderly. But I must say it is good for our mortality rates because we know age is a risk factor for increased mortality. The elderly people who catch the infection, even if they don't have underlying conditions, are more likely to die than a young healthy person who catch the infection. And I believe that may be what is speaking to our mortality data. If young people without underlying medical condition catch the infection, they are more likely to recover as compared to the old. So at least from statistics in terms of our mortality, it is better for young people to catch the infection rather than old people.
That sounds better. That sounds refreshing, honestly. What should we do as young people? What should we do so that the infection rate within that range, that's below 50, what should we do so that we can prevent that as well?
As we are aware, this disease has no known treatment or vaccine. So the only thing we can do is to adhere strictly to the preventive measures. Over the last couple of days, we've heard that we've reached our peak. That is a debate for another, discussion for another day.
Definitely.
But if we reach our peak, then that is the point in the epidemic curve that we should adhere strictly to the preventive measures.
Okay.
When we say we've reached our peak, it means we've recorded the highest number of cases on a day basis or over a period of time, at regular time interval within the epidemic curve. If we say we've recorded the highest number of cases, then it means those persons whom we've picked out of the society as at that point in time might have also had contact with persons who have not yet developed signs and symptoms or who have not been tested. So assuming our peak is, say, 100 cases, if we are saying once you get a virus, you can pass it on to between 2 and 4 people, then if our peak as at the time we recorded it is 100, then we are saying about 200 or 400 people might have had contact with these persons and they could potentially also be carrying the infection. So what it means is once we've reached our peak, we should adhere strictly to social distancing protocol because it has been proven that once you adhere to social distancing, you break the chain of transmission and then you begin to see a drop in the infection rate that you are recording.
Okay.
And also we must stick to the precautionary measures, the hand washing, cough and sneeze etiquette, and then all those things.
Yes, sir.
Eat healthy so that at least your immune system will be strong enough to be able to fight the virus even if you get it. Apart from that, there is nothing we can do. And then let us try and stay home as much as possible if we have nothing doing in town.
Definitely. So the government...
I think the wearing of the mask, if we strictly adhere to it, may also make some impact as far as slowing the transmission is concerned. But we should be very careful the kind of masks we wear because not all those masks are protective enough. And what I've realized is once people wear the mask, they tend to throw the other precautionary measures, especially social distancing, away. But if the mask is not giving you maximum protection, if you break this social distancing protocol, you can catch the infection.
Okay. Dr. Paul, the government hoped to rein in the Madagascar cure that we've all been hearing about. Do you think it's a good move?
At this point, we are all racing behind time to find either a cure or a vaccine. Organic preparations or herbal preparations, have been proven to work in some instances. In science, we look at the data to determine whether something is working or not. These orthodox medications that are prepared, there is something we call clinical trials. So once the medications are made, they are tested on human populations over a period of time in phases to see whether the claim of the manufacturer is actually being realized in the field. So I have no problem with us trying the Madagascar, whatever, but it should be subjected to pure scientific analysis to be able to tell whether it is working or not. Other than that, as a scientist, I wouldn't say we should just pick it and then administer it on people when we don't know how it works.
Definitely.
And whether it's going to be able to cure the persons or not.
Thank you so much, sir. Thank you to Dr. Paul Owusu Ojo. He's a public health analyst and he joined us. Now,